knowledge gap between the medical establishment and the patient is a choice. There is the knowledge gap between medically trained personnel, such as a doctor, and their patients. This is demonstrated in how medical professionals speak to their patients, and it's extended to how entire organizations, such as pharmaceutical companies, communicate with them. The knowledge gap stems from several key factors. Firstly, educational background plays a significant role. A medical professional undergoes extensive training in anatomy, physiology, pathology, pharmacology, and treatment strategies. Most patients, by contrast, have limited medical education and varying degrees of health literacy. The complexity of medical information contributes to this gap. Medical terminology and diagnostic criteria are often highly technical, making it challenging for lay people to fully comprehend even the most basic of health topics. Additionally, the difference in experience and context is crucial, as doctors gain practical insights from real-world clinical settings, enabling them to apply their knowledge effectively, whereas patients may struggle to relate medical advice to their personal circumstances. Access to information further exacerbates this divide. Doctors use professional journals, medical databases, and advanced diagnostic tools, while patients typically rely on general internet searches. We all know that these can result in incomplete or inaccurate information. Access to information is a core assumption around patient-centered care and patient empowerment. But what if this information is terrible and not at all evidence-based? What if the information that is from a reliable medical source is poorly understood anyway? So they opt for the information that they are able to grasp. Where does that leave patient empowerment? Whether the medical professional widens or closes the knowledge gap is a choice. They deliberately opt to accommodate to the patient or alienate them by the lexical and stylistic choices that they make. Sometimes it can be a deliberate choice in order to make themselves sound authoritative. After all, using jargon shows how clever a person is. This means that sometimes deliberate choice of style can be part of an ego trip too, but ultimately this comes at the expense of the patient's well-being and eventual health outcomes. Let me explain that again. If you are a health professional or medical writer or clinical researcher, how you communicate with your patients is a choice. It is a choice that you make, and it's a choice between either cultivating your own ego or addressing the needs of your patients. It's a choice between pushing the patient away or bringing them closer to you. This is not just happening in medical encounters, but it extends across the entire life sciences industries, including and especially the pharmaceutical industry. It's evident in the points of patient contact where written information is provided, where sadly it is the norm for patients to receive shoddily written materials that are consistently difficult to access, process, and act upon. There is little to no appetite for change. It is my opinion that this resistance, this stasis, not only alienates the patient but treats them with disdain. This is the key practice that demonstrates the level of sincerity a company has to the patient voice agenda. If you do not concern yourself with what a patient has understood from your consent form, if they've understood anything at all, then the commitment that you claim regarding the patient voice is completely fake, and it's as simple as that. Thank you for listening. This was originally written by Mark Gibson, Leeds, United Kingdom, in January 2025.